roll call.
Mm-hmm.
Now that we're recording, would you please go ahead and start with the roll call, and then you can head right into the reading the theory of change and the land acknowledgement, please.
Worse. Okay, please say here if you're here. Um, I know Devin is not here today. Noah Fay.
Here.
Eddie Matlock Mahone.
Here.
Martha Linder.
Here.
Portia Anderson. Patricia Sam. Elliot Hart.
Here.
Antoinette Lambert. Kelsey Beckmeyer.
Here.
Jaja Floyd.
Zaza is in as an attendee.
Oh, let me move her over. Oh, okay, promoting everyone a panelist. Okay, Jaja
Here.
Floyd. Thanks. Kenyatta Carol Hillman. Barry Tillman. Okay, with 6 members present.
I think quorum has to be 7. Is that right, Alex?
It does. We need one more person to join. If anyone has any phone numbers, I will send an email to get more people in here.
Oh, there's Patricia.
Oh.
Patricia.
Hey, Patricia. I'm going to mark you as here. Perfect. 7 members present. Quorum is met.
Welcome, everybody. Okay, great. Thank you. Thanks for all being here today. I don't know if it's worthwhile for me to share my screen and have the agenda, or do folks have the agenda kind of pulled up on their computer as well? Sometimes I like not sharing the screen because then it's nice to actually be able to see the boxes with folks' faces. So, oh, and excuse me, Alex, because the next thing on the agenda is if you could please read the theory of change and our land acknowledgement.
Yeah, sure. Land acknowledgement. The King County Continuum of Care Board acknowledges that we work on the unceded traditional lands of the Coast Salish peoples, especially the First Peoples of Seattle, the Duwamish people, the original stewards of the land, past and present. We honor with gratitude the land itself and the Duwamish tribe. This acknowledgement only becomes meaningful when combined with accountable relationships and informed action, and is the first step in honoring the land that we sit on and their peoples. In the theory of change, if we create a homelessness response system that centers people who have lived experience of homelessness, then we will be able to meet needs and eliminate inequalities in order to end homelessness for all.
Wonderful. Thank you, Alex.
Mm-hmm.
Okay, welcome everybody. Thanks for reading those pieces and grounding us in our work today, Alex. The next thing that we had on our agenda was, and as you can see, for those of you who are committee members, we have other folks with us here in the space today. And those other folks who are here with us in the space today are our coordinated entry team. So really the idea was that we just wanted to have the team come and join us today and put some time on the calendar for everyone here to kind of be able to meet and greet a little bit. And then we have some time just for us to, if you as the committee members kind of have any questions for our team about, our workflows and, current operations and everything. I know that the last time that we met at the beginning of this month, I gave a presentation kind of giving a high level overview of how the coordinated entry system currently works. So today we have a little bit of a chance for you to talk with some of our members and talk a little bit about that. So, just kind of wanted to open that conversation now. So maybe if we could just go around with our team. Karina, I see you in the top right corner, so you're up first. If you want to just come off mute and say hi to the committee, maybe we can do like name, pronouns, your position, and then kind of, what that means. So.
Okay, I'm Karina Jordan Hernandez. My pronouns are she, her, or they, them. I've been a specialist on the coordinated entry team for a little over 2 years now, and I manage CE resources for the veteran population, AIAN population, and True Blood or Phase 4 funding populations, as well as right now supporting with single adults. So really the biggest thing for if you have questions about veterans, AIAN resources, or True Blood Phase 4 and how we manage those resources. I'm your point person. All three of those populations run a little bit differently than the other populations. So sometimes you might need to reach out to me, and I am always available.
Thanks, Karina. Sorry about that. It took me a second to find my mute button. Thanks, Karina. Nicole, how about you? Would you like to go next?
Sure. Nicole Fillmore Mashesha. I use pronouns she, her, them, they. But most importantly to me, one of my values is really in fairness. And so I exhibit that through collaboration, and I apply that to my work by really working on community building. I've been here almost 2 years, and I serve the young adult population, and I really feel like we're bringing it together as a community, and that's something that's really important to me, to make sure providers feel supported and make sure that folks get connected to housing. Thank you.
Thanks, Nicole. Surya.
Hi all, good morning. My name is Surya. I use her, they, them pronouns, and I've also been a program specialist for about 2 years. I mostly manage the family resources and also help right now with the single adult units, and yeah, I can't think of anything particular to my position at this time.
That's great. And last but certainly not least, Leah.
Hello, everybody. Leah Sima Fahouri, she, her pronouns. I am the program coordinator on the coordinated entry team. So really here to support the team. Anything to do with like lease ups of new projects and funding opportunities that are coming in to lease up new projects, kind of under my purview. Additionally, like the mobility transfer process. And then any projects that are being implemented by the team and by the system are usually like things that I'm working on. So like inventory is the most recent project that I've been dedicating a lot of time to. Our coordinated entry DV system and like improvements and policies and all of that stuff are things that I've been focused on. So really just a lot of all the other projects is kind of what I'm dedicating my time to. And then like data cleanup. We love data cleanup. So yeah, that's me. Hello again.
Hey, really quick, Zaza's an attendee again.
Thank you. I'll move her over.
Come back to us. Come back to us, Zaza.
Okay, she has been promoted.
Can I say quickly, I talked to Patricia Barnes-Sams and she said she's in here. So is she also in the
She is
public?
here. She's
Thank
here
you.
as no, thank you. She's here as a panelist, so but thanks for doing that. Wonderful. Yeah, so we have a little bit of time here on the schedule, on the calendar. If any of you, as committee members, kind of have any questions that came from the slideshow and like the overview of some of our operations from the last time that we met, we just wanted to be here, to kind of connect with you all, and chat. So. All right, I think that was 10 seconds. So I usually go on 10-second rule. Oh, Kelsey, I see your hands up.
Thanks, Tom. I would love to hear from the CE team kind of broadly around if there are any particular trends that you are seeing within the subpopulations that you're supporting when it comes to gaps in services that there are, or any particular challenges within the coordinated entry system that you think would be important to elevate and highlight for this group.
Yeah, that's a great question, Kelsey. And I see Nicole's hand immediately shot up too, because I think if we're on the same wavelength, Nicole, as she mentioned before, works with the youth and young adult population. So, um, some of the things that come up with youth were also some of the first that came to mind as I listened to your question, Kelsey. So, yeah, Nicole, I'll pass it to you if there's anything that you'd like to highlight, in answering Kelsey's question there.
Sure, thank you. There's a particular gap in service for young adults that have a developmental disability. Mental health and developmental disabilities are served very differently. The service models, more on independent living and getting people connected to the community and connecting them to resources like job coaches and DVR. And that's not something that our current providers are geared toward. So that will be the number one gap. And also the second gap, which is not even, actually, I wouldn't call it number one, it's number one as well. And that would be young adults needing PSH that are 23, 24, close to that mark where is it worth it to put someone in a facility, in a housing situation where they'll only be there for less than a year or for a year, and then having to look for another resource for them. So something to support those needing a PSH, regardless if it's for developmental disability, mental health, or SUD. It would be really great to have some intermediary or a provider that's serving that transition group. Thank you.
Yeah, thanks, Nicole. Something else that comes to my mind, as Nicole, raised with youth and young adults, is that we, the mobility request process kind of comes up for me too, as one where I think that, and I know that I think we'll talk a little bit more about that in the next piece of our agenda here too, because I know, or I think that members of this committee have raised that as kind of an area of emphasis, or something that we're wanting to talk more about and sink into as we do this work together. But I would say, certainly for when Nicole was talking about youth and young adults needing transitions into single adult permanent supportive housing, there are friction points that come up in navigating those transfers and permeating those population groups. And I also think too, with mobility requests in general, something that we come up against is friction with chronic homelessness requirements, and kind of what those sometimes in someone's housing journey, as we all know, not all of them are linear. And so, when people have novel episodes of homelessness, in between, like during their mobility request time, maybe they did sign a mutual lease termination, or maybe they were evicted. That's the hope and the goal of a mobility request, is to always avoid those types of occurrences, and they do happen. And so I think sometimes then being able to work with that and navigate someone to a suitable resource, when they might have an active an approved mobility request with coordinated entry. What they are eligible for is a separate question, you know, so that's something that comes to my mind as well, Kelsey, in your question. Surya.
Yeah, I think with families in particular, there's a lot of frustration about kind of like understanding coordinated entry as a system, or, you know, how to access resources, because of there's a lot of scarcity in resources in the family space, in specific. So, you know, the idea of coordinated entry is for people to get their assessments, and then for families in specific, there's a sense of like, okay, well, what now? You know, I got my assessment, and then I'm just kind of waiting on, you know, for what am I waiting for? What happens? You know, I was told that coordinated entry is a way to get connected to housing in a way. But because there's very, very little resources in this population in specific, yeah, there's a lot of frustration, and with that said, you know, little resources in the family space, and also a very limited kind of like types of resources. You know, not a lot of permanent supportive housing, which, you know, is a need in the community. So, yeah.
Yes, Surya, thanks for raising that and bringing it to this conversation. Eddie, I see that your hand's up too.
Yeah, just kind of adding on to the whole mobility request or mobility transfer thing. I think one of the things that we come across in our agency, like when we're trying to do one that's interagency, not interportfolio across different agencies, a lot of times it's the case managers at the housing programs that are submitting these. So they're not connected to the coordinated entry system at all, really, and like how they're not an assessor. They don't have access to the team sites. They don't know how to nominate people. And so it becomes a big challenge when if somebody is not appropriate for a site that they're originally were in, to because somebody else is going to have to do that nomination work, and we don't necessarily know anything about that client type of a thing. So I think that should be something that we should probably try to figure out some type of a process for, because that's definitely a big one for us, is we're like, well, I don't have access to coordinated entry. I don't know how to do it, especially with the whole team site now, where
Yeah.
it's a much bigger process to get actual access to it all.
Yes, Eddie, thank you for raising that, and it makes me think of Lee. I see your hands up, and I'll call you in just a sec. But it makes me think of one of the, you know, after having worked on this team for a year and now stepping into this new role, one of the things, one of the things that is high on my priority and something that I'm wanting to bring to this group for us to talk about and work on is how the hub and spoke model of how we are working and using Clarity and working with BitFocus to train our like HMIS leads and CE trainers and liaisons to, you know, manage and to manage the assessor pool, and provide that technical assistance and have everyone who are assessors have that be like an appropriate relationship with the system. Because I think when we made that transition last year, to having mobility requests, you know, be navigated to their new resource by housing case managers, well, that is a wonderful idea and wonderful concept, sure, because as you all can see, like our team is small but mighty, but we can't do everything, you know, and I think like there was an overwhelming workflow in like someone in say Leah's position as the program coordinator to manage navigation for all, you know, the active mobility requests in the system, clearly unsustainable. And particularly for a population like single adult, when we go back to those providers and say, thank you for submitting this mobility request, it's approved, now it's your responsibility to navigate this person to a resource. Well, I was a CSS at a DESC permanent supportive housing site. We don't have HMIS wasn't necessary for that role, you know, and so those folks don't have HMIS access. Those folks aren't coordinated entry assessors. Those folks have never, you know, needed to know how that system works, and so there's a leveling up that we as a community and this committee need to do to work together to kind of retool and scale up our coordinated entry assessor and HMIS lead and CE trainer kind of positions. Leah, was there something else that you wanted to add to that as well?
I actually was just gonna chime in on what Sadia was mentioning around the family units, and just to share like a little bit of like we were noticing like a significant decrease in the number of units that were coming available in family, and I did a bit of an analysis from January to June of this past year, because again, this was like a while ago when I did it, but you know, we saw 191 units come available during that time period. 118 of them were in January, and there was just a steady decline. And like by June, we saw 13 resources come available in the family space. And so I just think like just uplifting that like there is like that issue that we've identified of like just so few resources in that space is making it hard to see like momentum and movement to housing families in particular. Yeah, so I just wanted to chime in with that.
Thanks, Leah. Sherry, welcome. It's great to see you, and thanks for being here. And yeah, was there a question that you had for us today too?
Yes, apologize for being late. I always have a dual meeting at the same time, so had a guest speaker, so yes. Anyway, so I know I'm late, and you probably said this before, but mobility requests, again, what was that? Because I know like mobility requests that we use is for, like if they're already somewhere and they need to leave that place to go to somewhere else. Is that what you're saying, or maybe I'm missing it?
Yeah. So really, the idea behind the mobility request policy in general is to maintain, like, for folks to, you know, we help folks who are experiencing homelessness find a permanent destination. Then the idea behind the mobility request is how do we make sure that folks stay housed and do not return to homelessness? And, you know, so different things that might occur, you know, if someone, if there's an imminent safety risk, you know, there's different pathways that folks have for like the mobility request process. But for example, a couple are like imminent safety risk, changes in service need, whether that's an increase or a decrease, change in household size or family composition. And then so when situations like that arise, sometimes those are things that have led to people returning to homelessness in the past. You know, our family either gained a member or lost a member, and now we're no longer eligible for this resource because it says that the household size must be 4 or must be 3, and now it will just be myself, so I'll lose my subsidy. You know, so that's what that exists for, to be able to give a valid and legitimate way for someone to transfer for one type of resource to another.
So, okay, so another question. So, for example, I get calls for families that are in low income or affordable housing, and they do need to leave because of a DV situation. And I don't want to put them back, you know, like say, hey, you got to get back on the waiting list and get into shelter. Would that qualify them for that mobility request?
It depends on a couple of things, and this is a great question, Sherry. So certainly, I actually think a fantastic question that, you know, we should talk about, you know, even more deeply in a space outside of this one. But for the purposes of just kind of like this conversation, the eligibility can depend. So in order for someone to be eligible for a mobility transfer, they must be living in a project that receives referrals from coordinated entry. So if they're in a low income housing, or, different type of setting at a building, at a project that has nothing to do with coordinated entry at all whatsoever, then they're not eligible for a mobility request through our system. And then also too, I think particularly when you raise the pieces of why someone might need to adjust their housing situation due to domestic violence, there's also particular, contextual and systemic pieces that come up with that as well that I think would be great for us to chat about outside.
Sounds good. Thank you.
Yeah, of course. Thanks for that question. Leah, your hand's up.
Yeah, as soon as I spoke, I was like, oh, here's another thing that our continuum needs. I think the thing that we see a lot in the single adult space, and particularly when we look at mobility transfers, but just like in general, is the like huge gap in the system of durable subsidies. A lot of times we will see clients in rapid rehousing that need a durable subsidy, like they just cannot afford rent because, again, rent in Seattle is very expensive. And so once their rapid rehousing dollars, right, like their time in that program ends, right, they're no longer able to afford anything, and they're not quite the level of a permanent supportive housing, right? They don't need that extensive supports, but that is kind of the only thing that we have access to in the single adult space that is going to provide a durable subsidy. And if they're not an appropriate fit for a PSH because they don't have a disability or they don't need that extensive level of service, we don't really have a lot of options to direct them to. A lot of that is held by the King County Housing Authority, the Seattle Housing Authority, right? Like all of Section 8 is held there. And so we just don't, that's something that we're really missing is durable subsidies for folks, and because that is like genuinely what they're needing to end their episode of homelessness. And like across all subpopulations, but like single adults is where it comes up the most.
Yeah, thanks for raising that, Leah. Something that I also just put in the chat is also when you mention tenant-based vouchers like Section 8 being mostly available through the King County Housing Authority and the Seattle Housing Authority, Renton Housing Authority too. So just to remember them and include them in on the fund. Patricia, I see that your hand's up, and then I think we'll take Patricia's question, and then we'll go ahead and move on to our next agenda item too. So yeah, Patricia. You're still muted, Patricia.
Got you. My phone is playing tag. Thanks everybody for your input. This is really good. I appreciate everything I've been hearing so far. And this question I have is a general question about the mobility, learning more about the mobility process. I'm at DESC, and when I was on BERT, we did support client with that process. My question is, I'm finding out, like we were stated earlier, the process, so say a client requests or is asking for a mobility transfer, who is the supporting person? Would that be the case manager? Because, and the reason I'm bringing up that now is I've had previously worked with some of the housing, public permanent supportive housing within DESC to help clients get that, but I know it can be a tedious process. But then also currently working with someone in the community that has been asking, and we're trying to give them support. Would that be like if a client asked about a mobility transfer, is that on the case manager? Who's responsible for helping that client and supporting them with the next steps in that process?
Yeah. That's a really great and important question, Patricia. And I think similar to like with Sherry's question, I'm gonna put my email address in the chat just in case there's a chance that some or all of you don't necessarily have it, but getting into the nuts and bolts of answering that question, I think would be a great one for us to chat about, outside of this meeting. So please, send me a message and we can find a time to set up a phone call and chat about that, or a Teams meeting. To like high level answer your question is, it depends sometimes, because as we know, with people's, like I said, housing journeys can be very unique, and non-linear. And so sometimes, usually, the person who would be submitting the mobility request is that person's, housing, like, team, their care team in their housing environment. If they're living in an environment where they don't have a care team on site, then usually it would be someone who's providing, case management and housing stability and support services to them. Sometimes when we do see mobility requests that come from folks that aren't there, and our goal is to say, please make sure that you're connecting with that housing team, so that everyone's on the same page about what's going on. As we all know, in our work, in our lines of work, triangulation and communication is so important. We want to avoid that confusing scenarios where people are kind of, wait, who's on first and what's actually going on. So, for us, it's I think the primary goal and standard practice would be for the care team that's working with the person, on site, if they are at a project-based location. And then but it's not a hard and fast requirement. However, the hard and fast requirements would be that all folks that where that person is living and who's managing that property is aware of what's going on, and that we're all communicating about it to make sure that we're not, making things more difficult or confusing for anyone. That's the last thing that anyone wants or needs. So
And
yeah,
then lastly, quickly, there's paperwork involved in it. So
yes.
where is the resource and the paperwork for the mobility? Where can the case managers, and we're all educating one another, where would we go to get that paperwork? And I think that's what one of the people that we're working with, the confusion is, where do I go for the resources? How do I start the process? Who do I go to? I've been told to do this, but then I've been asked to, I'm just advocating now to do it myself.
Yeah, of course. I just put a link in the chat. It's our
Okay.
coordinated entry website, and the forms and documents are all available there. They're underneath the section that says, oh, I'm on the, yeah. They are underneath the section that says additional info, and then it says forms and documents. And when you click down, the first one that comes up is the mobility request form. So that's where that's located. This is good. Thank you for that question and for clarifying that for everyone. Wonderful.
This is
Okay.
helpful. Thank you.
Yeah, of course. Well, thanks everybody for your questions and for a great conversation with our team. Team, I don't know if there's any last, parting comments that you want to share, or anything kind of before we wrap up this section to move on to the next. Nicole?
Well, first, thanks. I'm happy to be able to meet you all. And then second, just so you know, we're willing to come to staff meetings and go over processes if that's something that your team would be interested in, so that we can spread that message, across your organization or the team that you're supporting. And so we do parties, so it's fine. You're more than welcome to reach out to us, and we will come through and make sure that that you understand the processes and that we can get you through.
Thanks, Nicole.
Hey, I see Janelle and the attendees has her hand up.
Alex, should we promote her to a panelist and have her join us? Yeah, thanks for pointing that out, Eddie. Just waiting to see if, if Janelle's trying to break on through from the other side, so to speak. And then Alex, I don't know if you're there, maybe if you stepped away for a sec. I've never had to promote anyone from an attendee to a panelist before, so I'm trying to do that from my participants tab. But in the interest of just kind of moving forward right now, if Janelle pops in and she has a question, we'll certainly be happy to take that. But let's keep it moving here on our agenda and kind of step into our next piece, which is what I want to do is just review the Coordinated Entry Committee's goals and the areas of emphasis that you had all brought to Beth in this space sometime in the last year, and for us to kind of talk about those areas and begin to develop a strategic work plan together. You know, what are the things that we want to be working on, and then how are we going to, what are our goals there, and then how are we going to be working towards setting those. So I apologize because I actually I searched and I was not able to find, you know, a list of notes from the meeting where you all had brought these areas before. So forgive me, but I am going to ask maybe if we can just go through, and if everyone wants to share, you know, either what you remember as your priority or area of emphasis from a few months ago when Beth brought this question to you, or if you have a new one, you know, if that has since shifted and changed, this is also an opportunity for you to name that. So, and I'll just go ahead and do this by calling on the people who are here in my rows. So, Eddie, you're front left and center here for me at the top. So we'll start with you.
I'm trying to remember what that priority was that I brought forward. Well, maybe that'll come back to me. I think one of the big priorities is just making sure that there's transparency in the system, that everything is clear. If something does deviate from the norm, like resources for a particular site clean or site removal or something like that that happens, that type of stuff is like communicated out and like reasonings behind it, like, because I always hear rumblings in the community when they hear about that. People don't, not necessarily too happy that why were they priority over somebody else type of a thing. So I think just trying to build better transparency around how resources are prioritized for different populations is one of the big things for me right now.
Yes, thanks for offering that, Eddie. Noah, I see your hands up, and I'll call on you in just a second. I want to just one thing that you said in there, Eddie, that I you know, since we're in a recorded and public facing committee meeting, is just to be super clear about how our team doesn't we don't schedule, you know, encampment removals or clearings, and our team actually has nothing to do with the kind of like designing the operations behind those are kind of carried out throughout the region. So
absolutely.
So I just wanted to make sure that just because, you know, I also think
just
too,
the intersection of how the resources get prioritized for those events that happen.
Exactly. Yes. And so I don't mean to, you know, split hairs, but I do think that particularly with
it's an important distinction.
Yes. Yeah. And just making sure that we're always being real clear about the things that CE does do and that which we do not do. So, but thank you. Yeah. Noah, I saw your hand went down, but did you want to say what your priority item was, or was there something you want to chime off of Eddie?
Yeah, a little bit of both. Yeah. I recall this conversation, I think vividly. And if I don't want to speak for the rest of committee members, and so I don't intend to, but I do recall momentum around a suggestion that I have long been a bit of a broken record with CEA about, but felt like it is super critical And I am really invested in finding a way to do a better job of both prioritizing and service matching people to the resources in our community. I think we've gotten better as a community, as CEA. I think it's great, and we've been open to some feedback on this. I think, and it's moving in the right direction. However, we're still just too blunt. We are still routinely referring people from DSC's experience, and we are referring people into our programs who I don't think are an appropriate service match. I mean, obviously, we've got the horrible dynamic that every one of those referrals are people who desperately need a place to live. But we are hearing directly from the people being referred that they don't want to live in the type of PSH we're providing. And then on the flip side, it's our team is, our programs are funded, staffed, and designed to meet the needs of a sizable but yet subgroup of people with really profound behavioral healthcare conditions. And we routinely are getting people who don't have those needs and so don't need, for example, 24/7 staffing. And so when we're making those referrals, not only is that not a great use of that resource, that just leaves out the very people who do need that resource on the street. So like, I have some tangible ideas of things we can do. One of them is, we've got to find a way to expand upon the prioritization schema that relies on length of time experiencing homelessness. There's got to be more nuance there. So to me, that is super critical, and this is a good opportunity to try to make some improvements there.
Yes, Eddie. I'm so sorry. Yes, Noah. Thank you so much. Really important conversation that has been in existence from the beginning of CE and still something really central and important. And you raised some really just the critical needs there. So thank you, Kelsey.
Thanks, all. Building off of both of Eddie and Noah's priority pieces, I think something that is really critical for us to do, particularly as a committee, is looking into the by name list development and how that is also enhancing a gap analysis so that we have a better understanding of the direct needs of folks who are experiencing homelessness in our community to then map out what are we missing. So by getting a deeper understanding of individuals' needs and what they are looking for in housing, comparing that to current inventories and current resources that are connected in coordinated entry, and doing some work to bring in within our coordinated entry system resources that better meet the needs of those who are seeking supports. So, what are we doing to bring in our housing authorities? What are we doing to bring in access to prevention or diversion in a more coordinated system? So I would love to see just a marriage of by name list development and then a needs gap analysis. So how are we kind of doing some system mapping to look at what growth areas are we needing based upon what the knowns and unknowns are in our community. And I know that there are some tools that HUD has that we may be able to leverage and kind of use to help kind of guide some of that information so that folks are getting connected to what it is that they need, and we are being really good stewards of the resources we have in our community to ensure that units aren't going vacant, units aren't seeing high turnover rates because folks aren't getting connected to what is needed. I would also love to see just how we can leverage some of our rapid rehousing in a more strategic way so that we are seeing, rapid placement into housing and knowing that might not be the end goal for some folks, that rapid rehousing may be needed to be a bridge into permanent supportive housing or other permanent housing options, but that we have availability within our rapid rehousing to really kind of think creatively around how to pair this with bridging into higher support levels so that we're really using, not just housing first model, but a progressive engagement model of, we may need to do the lowest level service right now while we kind of figure out, and with an individual, like, does this work? And having more fluid opportunities into more permanent resources.
Yeah, thanks for raising that too, Kelsey. And Sherry, I see your hand and I'll call on you in just a sec, but just to piggyback off what Kelsey's saying is that I hear that, and I also see that as in a way a direct connection to also that which like Noah is raising too, about if we are able to do that needs gap analysis, if we are able to widen the variety of resources that are available to folks, then we don't have as much of that kind of like bottleneck and log jam of, you know, effectively all folks who are enrolled in the coordinated entry system program who are in need of a durable subsidy and a permanent resource being referred to some of the most abundantly available resources in coordinated entry, which are these, you know, very well resourced PSH units. And so I think that it's all connected there. So thanks for raising that too. Sherry.
So I just kind of like went back on what we had when the group had started, kind of what the things we were supposed to put down. I feel like I've kind of got some things kind of answered, and I know a lot of people piggyback on it. But I know one of them that I remember was like getting back to folks sooner. But now I know you can go in and do the different locations where you can go and do those assessments. Also like the turnaround time after doing it though, just giving well, I work with families, but people, folks updates, so that they will know where they are. Because I think sometimes people get lost in the sauce, especially if you don't hear from them again when they've done it. And then like I remember when me and my kids were homeless, and then we found a place, did the assessment, and our moving cost was paid. But I didn't know anything about like the rapid rehousing, and felt like I needed that to probably help me because I had just got a job. So like maybe at the assessments, kind of like somebody was saying, finding out what the need was to really help them to be sustainable, because maybe if I had that, I felt like I probably would have been um, able to be more sustainable, because it was like, okay, now I have to save, or I got these bills real quick, right? But no time to really kind of rest and kind of save. If I had help with the rapid rehousing after being homeless for so long, to kind of build up, like, okay, here's back to life. This is what the norm is, that kind of thing. And I feel like maybe, just again, like everybody been saying, just asking what are you looking for us to do to help you to remain sustainable. Um, and then the other one I had. Oh, another thing was too, like, I know everyone be like you nominate, like I know with us, like families are nominated, but there's a whole bunch of people nominating. And it's like maybe there could be another way to look at it as well, because I know before it was the more vulnerability, the higher you are. But what about looking at, well, also taking in effect, like how long a person has been homeless? Like that could be part of saying that they need something as well. If they've been out for so long, that can, I don't know, but maybe try to look at maybe another way too, because, everybody don't have issues and stuff like that. So, they may not get that help as fast as somebody that is more vulnerable. So, thank you.
Yeah, thank you, Sherry. A lot of what I was hearing in there is, as I was listening to you, I was thinking particularly around the parts you were talking about communication and turnaround time. I think of when we're having conversations about coordinated entry, groups like this, the different stakeholders that our team is working with, we often focus so much on how there's a scarcity of housing resources, and that's true. There's also a scarcity of the supporting services for people to navigate these systems as well. And I also think that, you know, the reality is that the systems are complicated, and I wish for my own brain stress that this wasn't the case. And there's so much to learn about, and there's so much going on with different program types and funding streams and guidelines and policies. And I think that one of the things that, as I've stepped into this role, a goal that I have for leading this team is seeing our work as, how do we take this unhinged ball of yarn, of all these different things going on, and make that packageable and communicable to our partners, our stakeholding partners, and then also, by extension, our clients, our folks, the folks who are using this system. If we're talking about coordinated entry, and I'm talking with a housing navigator on the phone when I'm the single adult specialist, and I'm trying to talk with them about how this is working and what to expect, so that they can communicate that with with the folks on their caseload, and we're having a disconnect, and they're not able, and we're not able to come to a ground of understanding, how is that person then also able to turn around and explain this system to the folks that they're being asked to work with? And in my opinion, if people can't really understand what's going on, and we're not able to talk about that, that's a huge problem. And I think that there's so much of that gets gummed up in these reasons why it can take so much time for turnaround about, hey, I've done my assessment, I've gone to a RAP site, what now? Or the other one I think we hear the most often too is, okay, I have this warm handoff email in my inbox. My case manager saying that I have a referral to a housing program. What does this mean? How long is this going to take now? What do I expect? All that kind of stuff. So I really appreciate you raising those points, because I think that it points to so many critical, like, interlocking things. Martha.
Hi. I'm trying to remember back to the discussion. But I think a big part was just kind of the transparency and kind of clear data collection. So like, if someone is referred to a property, and like, are they denied? And if so, why? Was it for lack of documentation, because they lost contact? Or did they decline the property? And as a assessor referring provider that my team is nominating folks, they don't know if someone's been referred. So we'll refer someone, they've already been referred to and declined that property multiple times sometimes. So we don't know if they've been declined, which properties they've been put forward for, and if they didn't work out, why. So that's been a real challenge. And I know there were other things that I can't remember right now at this point.
Yeah, no, but I'm feel free to chime in with them when they come back to you, if they come back to you. But for right now, that's a great one, and I think that's another thing that connects into what what Sherry raised, and we were talking about in terms of just kind of like this, the collective consciousness, about how this is all working and what to expect, so that we can all communicate more smoothly with one another. And kind of dial in on those processes, and then so that impacts the data collection. Because again, too, another thing, I don't know if someone else might raise this point, but something for me is evaluation. How are we looking at these operations and processes that we have going on here, and using that to inform the things that other folks in the space have raised to talk about, like prioritization, and service match, and needs gap analysis. So thank you. Jaja, do you remember in the past, maybe in the last year, when we've been talking about priorities for this group to work on? Do you remember if you had one or what that was?
I don't. I remember that No, actually, I don't remember, right?
That's
Yeah,
A-okay. I
okay, I
really,
don't remember it. Thank you.
no, that's A-okay. I really, I'm sorry. I don't mean to be like cold calling on people, but if it comes back to you, and we're chatting, please feel free to raise your hand and bring it to the space.
Well, I do remember that we were working on I don't I believe that we were working on maybe the prioritizing, the prioritizing theme, and that there were, I think, 3 areas that we were zooming in on, or 3 that came up. I can't remember what they are, but I do recall that part of it. If anyone else remembers, please step in.
Yes, 100%. I think that goes back to even when Alex convened this group last year, and I think one of the first things that he raised was a prioritization, and Noah kind of pointed at it too, is a changed prioritization schema that moves away from just looking at the length of time in the current episode of homelessness, and incorporates different types of uh, administrative data or HMIS data, looking at folks' gender, length of time. It would still include how long someone's been homeless for, their different, abilities or disabilities, diagnoses that they live with, and age, these different, that created a schema of factors that helped kind of expand. And
And
for a quick,
also the demographics, though.
yes, yes,
I mean,
exactly.
yeah, I remember the demographics and the ability or inability, so the abilities of people.
Yes. Yeah, and so, that's certainly a priority for the group. I don't want to kind of get too in the weeds, but we ran into some kind of parliamentary and just kind of like oversight governing kind of navigation with that, in terms of, that actually, since you bring it up, and I'll just say very quickly too, is that, where this committee sits and kind of its role in the governance and planning and policy for coordinated entry is, I'm really looking at this and thinking of it as a place where we can incubate and develop coordinated entry policies together, using data, using the experiences of the team, using all of our kind of own collective and individual experiences of how we're interacting with this system through our work. And then when we are talking about those things, this is a subcommittee of our, King County, Seattle Regional Continuum of Care board. And so those are the things that will need to then go to the COC board to vote on. And that's kind of KCRHA and others have raised too in the past. This group voted to approve to change prioritization structure, and then when it went to the COC board for a vote, they weren't able to move forward with a vote on that. So that's a little bit of kind of background and context there.
Yeah, thank you for that. And can I just say thank you for introducing the team of the coordinated entry, because that's what I felt was lacking. I didn't understand when Alex left how it was going to look and play out, right? And I'm so happy to see each individual in their own sphere talk about, the youth, the adults, the mobilities issues. I really appreciate that. I just want to say thank you.
Yeah, of course. And I know our team was real looking forward, and excited to come here and be with you all too. So I think, yeah, thanks, KCRHA, because that was great. Elliot.
Cool. Yeah, I can slide in really quickly. I have nothing new to share because I think people touched on the items that I had flagged a couple months ago. I think really just people have mentioned transparency. I think around mobility requests, around denials and data related to that, and figuring out how we can learn and improve based on that. And transparency around the referral process. I think something Plymouth is seeing is a decrease in the amount of people we issue denials for incompletes. But the more we can do around that, to me, it just means, what else can we share about our process? What else can we teach people about the gauntlet of layered funding and what requirements are related to that? And then to Noah's point, service match. I think service match is a big thing Plymouth is feeling, particularly at the Pat Williams Apartments right now, which is our recovery property.
Yeah, Elliot, thanks for kind of shouting that particular one out too. It's great. I am looking through here. I thought that this would be a very clear and straightforward process of using the cells on my screen that all of you are, inhabiting, and then people move around. So wasn't anticipating that. I think, Patricia, I don't know if you have gone yet, if you've been able to share, an area of emphasis or priority for you in going forward with this work.
Thanks again, Tom. I'm trying to remember back. It's been a while. So much has happened. What I would like to add is that I echo a lot of what has already been said. And as I was sitting here, I was just doing my little word mapping mime. And I have one big thing is improving systemic barriers, especially to our, that's a big one, using the best practices. I have things like equity in resources. And one big one is we talked a little bit about that, about placement retention, using a harm reduction and trauma-informed through trauma-informed care lenses, matching those supportive services. Collaboration. And just one of the reasons I am really here is to just improving systemic barriers and advocating for culturally appropriate, diversity and culturally appropriate services within our supportive services network. One thing that came quickly to mind is that our goal is me being in this, as a case manager, outreaching and just working with our community and population, hearing their voices. I heard Sherry mention a lot about lived experience, her experience, and bringing those voices in. When we do get our folks housed, the communication and collaboration where they can, we're building a lot of places, getting them put in there. But if you think about how do we prepare once, it's me, I'm thinking in a vision of when I build a house, who are the people I'm going to have living there? Who are going to be the consumers? What are their needs? What are their services? And a lot of what I'm experiencing is that the more chronic, not knowing how to even navigate. Some people have not had structure, and you put them into a site and they may not know how to turn on the stove and even use the stove, or even how to pay their rent. These come under the culturally diverse needs of the client. And as we are at each site helping to add more training and collaboration within the staff to when we get and start working with the people, are we bringing in some data? Well, this is what I'm finding out. As case managers, I'm also an advocate for my clients. So I'm also bringing in what they're experiencing to my team so that we can see what's working, what's not working, and try to improve the systemic barriers to help reduce the recycle and of them getting placed and then displaced again and just going through that cycle over and over. So that's my input for today.
Thank you. Thank you so much for sharing that. Yeah, I think, I really grateful and love that you raised the need to center equity, kind of at every turn, when we are making these plans and having these conversations and beginning to uh, develop some policy here. And the other thing that I was thinking of that you made me think of too as I listened to you is particularly around the culturally appropriate services. As I'm transitioning to this role, something that's come huge into my mind are our partners that we work with who are seeking to provide culturally appropriate services for their communities and being, contracted to funded and contracted to go through the coordinated entry system, and what we can do and how we can be of service to them to ensure that they're going to be providing services for their community, for the folks that, and oftentimes those communities being folks that are disproportionately affected and impacted by poverty, homelessness, everything. So I just, thanks for raising that. It's very important. Janelle.
Hello, everyone. Thanks, Tom. I am now promoted, which is great. I thought it might be helpful for the committee for me to kind of go over a little bit of how community impact is supporting and sort of like what our current goals and projects are that we're working on. So what we're doing right now is we're kind of the mechanism for how all of these processes happen within the HMIS. And so our team spends time supporting the coordinated entry team and making sure that all of the data entry pieces and are in the HMIS and maintaining that. Right now, we're really focused on the stabilization of the coordinated entry system in coordinated entry in the HMIS. And so making sure some of the changes that happened in April of last year are reflected in the HMIS. So Leah's been doing a lot of data cleanup. We've been going through all of the different settings in the coordinated entry, making sure that those are all set up and make sense with the workflow. Like I said, doing a lot of data cleanup, a lot of outreach to providers, making sure that referrals are, if they're not accepted, they're sent back, and really making sure that we're holding ourselves accountable and helping the providers to make themselves accountable in the general coordinated entry process of how all of those pieces work. Also, as you know, we've gone through a big system update, which is with our inventory and supporting agencies through that and unit matching, which will help support a lot of what I'm hearing with the transparency and also what I'm hearing a lot with the service matching. And so those pieces, we're in the thick of supporting the community in working through those changes within the system. We're also working on the build out of these by name lists, which is basically your active or inactive methodology, in which you all would then be able to situate any kind of work regarding prioritization on top of. So our team is working hard to go through all the minutia of what it takes to put together a comprehensive by name list focusing on the youth right now, and then supporting our current by name lists, which are the True Blood and the veterans. And then we're also analyzing the CEDV system, which Tom, I believe, mentioned last time. And then also taking a look at the access and engagement part of our coordinated entry system, like Tom mentions, what is the training that is needed, what is the support is needed, what agencies should be in the HMIS or doing referrals that are not able to do that right now. And so that's a comprehensive look of how we can basically match that process up with, again, the changes that were happening April of last year. We're also looking and continuing to support the programs team as they work to define diversion and understanding what the mechanisms are in place to be tracking what diversion means in our system and how those diversion conversations are happening and where. And then also gearing up to reviewing our coordinated entry APR, which will be due next month. And all this to say, really putting the analytics and data systems in place so that my hope is next year we can start looking at doing an evaluation, which we haven't been able to do in the last couple of years as we've been building up the system, and be able to provide you guys all with the analytics that you would need to really have a comprehensive viewpoint as far as in the data of how coordinated entry is functioning currently, and then how you guys want to incorporate your vision into the system. So we have a lot of projects. I'm hoping that as you guys are kind of listening, that those are kind of lining up with sort of the values that I'm hearing, and I'm taking some notes and making sure that like we're in alignment with like what we're doing to set things up is what you guys are hoping to be able to build out into the future. So kind of trying to lay that framework or that groundwork to be able to, you know, build out a more comprehensive prioritization, build out a more transparent system, a more equitable and accessible system, and make sure that, you know, you have those service matching pieces that can be kind of pushed to the forefront. So just wanted to provide you all with that.
Yeah, thank you, Janelle. That's great because it's such, as we continue, you know, to shape the collective consciousness of like this group and this subcommittee itself, getting in there and having us all understand how much the profound chunk of overlap between the work that we here at Coordinated Entry are doing and the work that your team, Janelle, does in community impact within the RHA, and how much overlap there is between our two teams and the shared goals and projects that we have. So thanks for offering that to the group. And it's also a perfect segue because something that you mentioned, one of the projects that we're working on with your team is the domestic violence coordinated entry system. And that's the next thing that we had on our agenda here to talk about today. And so really what I wanted to do with this is to kind of first just provide everyone kind of an update and just for everyone's awareness about coordinated entry DV, and then just to kind of talk about some current happenings and projects that our teams here at the RHA, including, you know, the programs teams and community impact and our team are working on with the coordinated entry domestic violence system. So to jump in and kind of like set the space, for those who are not aware, there is a parallel coordinated entry system in our region in Seattle, King County, specifically for folks who are seeking with resources for folks specifically who are actively fleeing or attempting to flee domestic violence or intimate partner violence. And Leah or Kelsey, correct me if I'm wrong, but my understanding is that that definition also you know, includes folks who are victims of human trafficking or sex trafficking as well. So
Correct.
thank you. Yeah. And so, you know, for folks who are experiencing any of those types of situations or crises in their lives, there's a parallel coordinated entry system with resources specifically for that. That's not one that goes through our mainstream coordinated entry system that we all talk about here in this space with single adult, youth, family, veterans. It doesn't kind of umbrella underneath our mainstream system in the same way that those population or subpopulation groups do. And so that system is managed and operated by a nonprofit organization here in King County called the Coalition Ending Gender-Based Violence. And so we partner with them to, fund their operations for that, coordinated entry system. Leah, in the last year, has been working very closely with their, housing systems manager, housing director, Hannah Whitworth, to kind of make sure that our teams are in alignment to offer consult and TA for best practices for coordinated entry. And currently, I think Janelle kind of pointed toward this as well. The biggest project that we've been working on with them right now has been how are they managing their data, and what are the ways that we can partner with them to make sure that their data management practices are kind of concurrent with and up to speed with best practices. And so that has involved setting up a comparative but separate HMIS system, so homeless management information system, specifically for domestic violence coordinated entry. I'll actually kind of tap there. I'll stop there and then tap Leah and say if there's anything else that you want to say, particularly about the comparative data management system and CEDV in general that I kind of didn't get to that you think would be important for the group to know. Go for it.
Yeah, I think just to just chime in and add, so the parallel system that is run by the Coalition for Ending Gender-Based Violence, they call it DV CHAP, which is DV Coordinated Housing Access Point. Just some more details to share about how DV CHAP functions and what it looks like. They have the way that folks that survivors access that system is through the DV hotline or advocates who are staffed at different homeless organizations. There are around 105 different advocates who currently are able to assess and route folks to DV specific housing resources. And then additionally, the DV system in terms of like the housing stock is a lot of transitional housing, a lot of rapid rehousing, and like very few PSH, if any. And those are managed by 8 different housing providers. So just in terms of like scale, it's significantly smaller in terms than the mainstream system. So that's a little bit about like just kind of what's within the world of the DV system. Some things that we're working with the coalition, just to give some more information and juicy details. So right, we're working with them towards this this database, this comparative comparable database to our instance of Clarity, that would allow them to be able to track clients and who's getting referrals and like who's being housed by the system. So we're pursuing that, but then in addition to that, I'm also working closely with DV CHAP and Hannah to kind of re-solidify what are the policies that are in place, and likely those will come once we're able to start drafting some stuff. Those will come to you all for to look over and for our COC board to approve, and also working with them on what is their prioritization for how folks are routed to resources and identified for resources, and how we're determining who's most in need. And the other thing that I wanted to share is something that we're working on like more immediately is trying to provide the DV advocates with the training needed to access the mainstream coordinated entry system. We've noticed that there's been like a very deep divide and separation between the two systems, and we need them to be able to speak to each other more easily. We need survivors to not just have the resources that are available there, but to have the resources that are available throughout the mainstream coordinated entry system. And so we're really interested in partnering to figure out, to get like all of that staff trained as assessors so that they could access the mainstream system in addition to the DV resources. And additionally, sometimes we will have mobility transfers where someone needs a confidential resource or they need something that is DV specific. And so we need to find avenues and pathways, and we're trying to work with them on processes to allow for clients needing a mobility transfer to transfer into the DV system. So yeah, that's just more information.
Yeah, that's great, Leah. Thanks so much for providing all of that context. And I think just again, as I know that this committee, these members, you all have been here storming, norming, forming, all those good things over the last year. But I think particularly as I'm getting thrown into this mix and learning and growing the space with you all, just all great foundational awareness pieces for us to come into awareness together and keep on talking and moving forward. We have a couple more minutes on the agenda. I think I don't want to leave everyone hanging with just kind of being like, here are some of the things that we're working about CEDV, but I also know too that we actually don't have our next meeting scheduled because technically the last Thursday of next month is a holiday. It's Thanksgiving, and so the RHA will be closed. I would imagine many of you will also, those of you who are providing direct service, shout out to you all who will be working on Thanksgiving Day, and also others too of us who will not be working on Thanksgiving Day. So I want to make sure that we have a couple of minutes to turn to that, but then real quick, if anyone had any just kind of like lightning round, burning questions about the coordinated entry DV thing, we'll take those now and answer maybe one. We have time for maybe two of those before we kind of talk a little bit more about scheduling. So any questions about CEDV? Ten-second rule. I think that was the 10-second rule of silence. No new questions. Alex, I see you are ready. You're off mute. You're ready to go. Did you have anything you want to kind of talk about with scheduling wise?
I am ready to go. So our next meeting is scheduled for Thursday, the 28th of November. I was thinking, and if it works for everyone else's calendars, of just moving it to the week before on the 21st. Tom, Kelsey, I know I don't have access to everyone else's calendars, but I do have access to theirs, so I can see that they're clear for like the same time as this meeting is normally scheduled. Does that work best for everyone? I know if we do the week after in December, then we would then have 2 CE meetings that 1 month. So trying to find time to squeeze it into November. Does that work?
Works for me.
Okay. Sherry's giving me a thumbs up. Thanks, Sherry.
Works for me. Works for me too.
Cool. Does anyone have any objections to this moving of the CE meeting? Great. Okay, I will schedule it for the 21st, and I will send out an updated link.
Wonderful.
Thanks, everyone.
Jaja, Patricia, Elliot, or Janelle, other folks, if hopefully now if we kind of get this communication going a solid like month out, if you do have any conflicts that come up, Alex and I can work with you on that. And if we do need to pivot and reschedule again, but yeah.
I think it looks okay. I'm putting it on my calendar now, the 21st, same
Perfect.
time. Mm-hmm.
Yes.
Oh.
Yeah, and the other thing too is I think that, for a while, when we were in this transitional period with Beth holding the space, we were meeting for just an hour. This month I bumped it up to an hour and a half. Quick pulse check, how would folks feel about a 2-hour meeting? I think as we start to really talk about some of these areas of emphasis and the policies that we're wanting to work on, I can think of plenty of things for us that we can all talk about and kind of roll up our sleeves and get into that could fill 2 hours. I also realize 2 hours is sometimes longer than other people are able to commit to for meeting time. So pulse check on that. How would people feel about a 2-hour meeting rather than today I went for 90 minutes, but see a Kelsey head nod. I see a Sherry thumbs up.
The 90 is good for me today. It just depends on my schedule, but I liked it. The 90 minutes was a good feel for me. Normally I start at 10 at work, so it's like I'm just getting here, but it's doable.
Okay. Okay. Well, Alex and I will be in communication with you all earlier on this rather than later, so we can make sure that we're all kind of squared away for next month. But with that, and I know, thanks everyone for those of you who were able to hang out with us all the way to the end here. Thank you for doing so. But yeah, that concludes and adjourns our meeting for today. So thanks everybody.
Thank you, everyone. Have a
Thank
great
you.
week.
Bye.
Everybody have a good rest of the week. Thank
Bye,
you so much.
Patricia. Bye,
Thanks.
Jaja.
Bye-bye.
Bye, Sherry.
See you later.
Bye.
See you later this afternoon.
Yeah, we'll see ya.
Don't forget.
Got the
this
COC
afternoon.
special meeting.
3 o'clock.
3 o'clock. I'll see you there. Bye.
Awesome.
Can I? Oh, I can just go on to KCRHA to get the meeting, right?
Yeah, it's on the website.
Okay. All right. Thanks.
All right. See you there. Bye, Sherry.
Okay. Bye.